Thank you for tuning into my channel. Hopefully you subscribe by now. If you haven't, go ahead and push that subscribe button down in the bottom. My name is Kiana. I am a registered nurse. I recently acquired my master's in nursing education. I have been working in the ED for 6 years, and today we are going to be talking about graduate school. So as many of you may know, there are multiple options in pursuing a higher level in education. You could be a nurse practitioner, you can be a nurse educator, or you can also be a nurse midwife, which brings us to our guest. So we're going to be having a guest today. This is my good friend Meredith. She's been working in labor and delivery. She's going to tell us what it's like to work in labor and delivery. She's also going to break down how she chose a program to pursue, and then she's going to give us some tips on how you as a person can prepare for birth, and as a nurse, how you can advocate for your patient.
Hey everyone, my name is Meredith. I've been a nurse for almost 4 years, and all 4 of those years exclusively in labor and delivery. I'm currently a senior in a Master's of Science in Nursing program with a concentration in nurse midwifery.
Again, she also is in graduate school. So as some of you know, I recently received my master's in nursing education. I am now in my 2nd semester of the PhD program, soon to be Dr. Meri. So hey, you know what the vibes is. We're going to get into how we selected our graduate programs, why we pursued a higher level of education in nursing, and what our experience has been so far. So Meri, what made you want to pursue a higher level education in nursing?
Well, I was really inspired by my mom. My mom is a retired nurse practitioner, and so I knew I wanted to go back, but I wasn't necessarily sure what I wanted to do. So since I wanted to stay in women's health, I explored 2 options, which is certified nurse midwife and women's health nurse practitioner. They're very similar, but the certified nurse midwife does actual births and can provide newborn care. So I said, this sounds like way more than a women's health nurse practitioner. I'm sold. I'm doing it. So I applied.
Okay, thank you for sharing that. I had to find a preceptor for my practicum, which was also another unexpected challenge that I faced. So in that, like I said, I always had a passion for teaching, so I went ahead and pursued a master's in nursing education. And along the way, like I said, one of the issues I had was securing someone to do my health assessment and also finding a preceptor. So what was your experience like? How did you find a preceptor, and how hard was it?
Oh man, when I started this program, it was in 2019, January to be exact, and it was before the pandemic. So I was like, oh, I'll be fine. I have plenty of options for preceptors. Well, guess what? Then COVID happened. A lot of clinical sites started shutting down. They stopped allowing students to come in. I was scrambling to find a site. The first semester of clinical that we did have, I didn't get a preceptor until the last 2 months of that semester. And so I had to stop working. I had to take off about 6 weeks, and I had to do 4 to 5 days a week of clinical just to catch up to my peers. It was rough.
Wow. And so just like her, I graduated in the middle of the pandemic, but I did secure a preceptor. I told you guys about that in my Rags to Riches video. Make sure you check that out, link in the bio. But I did run into the same issues for schools. A lot of the nursing instructors actually don't have their master. So it kind of felt like, well, did I really need this? And the answer is yes, because eventually I'm going to go on to be a dean, which is why I'm in a PhD program. But what about you, Meri? So how was the experience, and does it feel like it's worth it, and how do you think it's going to benefit you when you graduate?
It's been very rewarding. I'll say that for sure. Rewarding, however, it's also been hard. It's hard work, 800 clinical hours, lots of assignments, clinical sites closing down due to COVID, and having to, fight over preceptors. It's been rough, but I'm super excited to graduate. I have 7 months left. Cannot wait.
Right.
And so I think this program, it's going to prepare me to be an entry-level certified nurse midwife. As far as, getting a job afterwards, the job market isn't really the best right now. So I'm going to try to ride it out. Same thing. A lot of places aren't hiring, but I'm hopeful.
And sometimes that's just what you have to be, because we have these plans in our mind of like how we want things to flow, and sometimes there's disruptions. We can't control the rate of this pandemic or when it's going to be over. When you are in graduate school, it's important that you have a job. So I did a video on per diem nursing. Make sure you check that out. Another option that may be good for you is PRN, but you do per diem, don't you?
I do.
Yeah, see, so you always want to have a plan A and B, because it's not guaranteed that when you graduate that you're going to get a job right away. And even some of my friends that have completed the nurse practitioner program and they have taken their boards, they haven't been able to secure jobs, because what I'm learning is that the nurse practitioner market is actually oversaturated. Whenever you decide to make the decision to go into graduate school, make sure that it is something that you love, and make sure that you have a secure job that you can hold while you pursue your higher level of education. Is there any advice you have for any like nursing students or any nurses that are considering going into midwifery? Like anything you want to tell them that you wish somebody would have told you?
Just get your labor and delivery experience, learn as much as you can, and then apply. Apply for midwifery school. We need more certified nurse midwives out there.
Okay, and at the end of your graduate program, do you have to take a certification test, or do you have to? Okay. So what certification do you have to take?
It's the Certified Nurse Midwife is the name of the certification, and it's by the American College of Midwifery boards.
Okay.
We take the exam just like how the nurse practitioners take the exam. We just have a different credentialing agency.
Meredith is going to give us some tips on how you as a nurse can help advocate for your patient, and then as a patient, how you can kind of speak up for yourself and some things to kind of know and plan for. So here we are. So basically, Meredith, as far as advocating for patients, what advice do you have for nurses out there that are in L&D and they don't really know how to speak up?
You're going to have to learn, straight up. You're going to have to learn to speak up for your patient. There are providers out here performing unnecessary interventions on their patients. There are providers that are, very quick to do a C-section when there really isn't a strong need to do a C-section. So if you know that something is out of the normal, stand up to them, say something, let your charge nurse know, do something. Because at the end of the day, if you were that patient, you would want somebody to do the same for you.
Thank you for that advice. And yes, totally. Just like in the emergency room, things are happening very, very fast. And so a lot of things can be like dismissed or swept underneath the rug. And like Meredith said, if it was you in that position, what would you want done for you? And as far as patients, I understand that a lot of people aren't properly educated in the medical field. So we're going to go over some things that you should try to probably have done prior to going into delivering your baby. And so one of the things that me and Meri were discussing earlier was a birthing plan. So what were you saying about when should a patient have a birthing plan?
I would say you need to have your birth plan set up and have it ready before you hit the third trimester. I feel like a lot of women, they spend time buying the cute outfits and decorating the nursery and throwing a baby shower, but they spend zero time on childbirth education, breastfeeding education. They say they want to breastfeed. They haven't taken a breastfeeding class. They haven't read a book about it. They haven't taken an online course about it. Nothing. And so then guess what? You're sitting there, you have your baby, you did it. You have your baby, and now you have no idea, how to breastfeed. You have no idea what to expect. Just the amount of, the lack of education. So, you're pregnant for, 9-10 months. You should definitely use some of that time to educate yourself on things related to labor, interventions. Research your provider. Make sure that the provider that you're choosing, to take care of you and your baby is a good fit for you. That's a major, major important thing. Make your birth plan. It is not necessarily about just having everything on the birth plan. It's about educating yourself and knowing what options are out there.
Okay, and so, yeah, that's really great advice. You always want to, if you're going into something, you always want to make sure that you have the proper education for what you're going into, so you can kind of have an idea of what to expect, so that when things aren't going the way that they should, you at least know what's going on, or you know what intervention to do until you can see your doctor. And so one of the other things that we talked about is, when is it important for you to go to the doctor? So when if a pregnant woman has some concerns, what are like maybe two main reasons why they should go in and be seen?
Okay, so first of all, any vaginal bleeding, you definitely need to go in and be seen for sure. If you notice that the baby isn't moving as often anymore, you should definitely come in and be seen.
Okay.
And lastly, of course, our favorite, if your bag of water breaks, please come in.
Yes. Bag of water broken, it's time to pack up and head to the hospital. So thank you for tuning in to this segment of our YouTube video on graduate nursing and taking some tips on, as a nurse, how to advocate for your patients, and if you are a patient going into labor or preparing to give birth, some things that you could do to better equip yourself for the process. And so, like she said, at the end of the day, the patient is at the center of everything that we do, and we always want to make sure that we are acknowledging what our patients want and trying our best to get it done if it is within our capacity. So as a patient, you have the right to say you don't want something done. You just have to speak up. Don't let them dismiss your concerns. If you are truly concerned about something, speak up. There are doctors and nurses that are far more than willing to explain to you. Meredith is actually going to be launching a program where she's going to provide education on some of the things that she listed earlier. And so find that information, find that resource, let your doctor know what you're thinking so that you can be at ease when you go through the process and that it doesn't end up being a bad experience in your birth, because giving life is something that is so beautiful. And I mean, you're bringing a whole another person into this world, and we don't want to take anything away from that. So hopefully you take something away from this video. Thank you for watching. Don't forget to subscribe to my channel. And like I said, as soon as Meredith gets a YouTube, the link will be in the description. Bye.